The African Leadership Forum is very important because this is places where different leaders from different places come and meet and be able to discuss issues around digital transformation in their countries.
And so very, very proud to have hosted the inaugural in-person eHealth Leadership Forum in Nairobi. Basically, where we brought together eHealth leaders from about 16 African countries, hosted by HELINA, Ministry of Health, OpenHIE, Africa CDC, and we're also lucky to have WHO Kenya office and Geneva representatives as well. And basically the purpose of this meeting was to discuss about leadership and governance.
Countries have been able to connect for the first time, and they've also been able to share experiences of the engagements that they're all pursuing. We think that this should be encouraged. It's a spirit of learn what works, adapt what is adaptable, and then expand. And once you've expanded, share how it worked for you so that others can walk the talk.
Was graced by the Principal Secretary and the Cabinet Secretary for Health. So I think that spells, in my opinion, how important the government leadership are taking this initiative on leadership and governance.
So leadership and governance in digital health is one of the strongest components. In fact, I would say that that's the backbone of a successful digital health infrastructure and implementation.
So it means that we are standing there trying to lead organizations, political leadership towards an achievement of digital transformation.
So in other words, how do we ensure that there is a political environment to provide an enabling environment where digital health can thrive?
This is the core of the Global Initiative on Digital Health, by the way, which has 4 pillars: countries' technical support, resource mobilization, making available digital health tools, but most importantly, the 4th objective of this particular working arrangement is convening. Supporting convenings for peer learning.
African countries throughout the world are recognizing that they have a very important moment and opportunity to create an integrated patient record and build that at a national level. And there are lots of digital health activities happening throughout Africa, but what governments are recognizing is that there's a need to coordinate those activities so that they can turn into this vision of one patient record.
It's all about making sure that our teams are aligned with the strategy that we develop, and leadership is critical, both managing up, managing down, and making sure that everyone is aligned.
So Africa CDC plays a continental role following the mandate that the member states have entrusted us with. The first thing we did is to come up with a digital transformation strategy that articulates what is important for us as a continent to align on. Leadership matters, so we are thinking about coordination, peer learning, forum like this ones. We host the Africa Health Tech Summit to really elevate the leadership to a point where we will hear more and more heads of state talking about digital health as a priority for their countries. The first time I heard a head of state talking about it was here in Kenya at the swearing-in ceremony of His Excellency President William Ruto.
Governments, through the governance framework of policies and regulations, require the necessary tools to drive the agenda through leadership. And so leadership for digital health is the application of the governance framework through the different working arrangements that governments have put in place, including the interministerial coordination, the various working groups. And so governance and leadership are all related, and that's why WHO is pleased that member states enshrine this area in the 3rd objective of the Global Strategy on Digital Health, based on the WHO ITU eHealth toolkit itself.
So it's very important to have this kind of meetings and of communities of practice where they can learn from each other, where they can share tips and tricks, and when they can basically support each other.
Learn from the peers who've walked the journey before you, who've already paid for the mistakes that you are likely to make if you do things your own way and learn by doing.
If we truly want to leverage digital health, we need massive transformation of our systems. And there is a lot of learning, a lot of experimentation that is going on throughout the continent.
We want to build the capacity of our service delivery point to be able to provide service paperless. And again, the capacity of every particular facility in Nigeria to be able to interoperate with other facilities so that we can have the continuum of care through the development of a kind of a federated architecture.
What is really important is that we leverage all those learnings and we share them and we learn from each other and transform our accessibility, our quality, and the affordability of health.
And they suggested a number of activities that they wanted to do together, some of which were sharing information so that they could advance the work within their own country. But in other cases, they realized that there were some activities that were important to the entire continent, areas where collaboration between countries was really important. For example, cross-border data sharing. And in order to do something like that, coordination is needed between various leaders.
And there we've proposed that at bare minimum, there has to be mechanisms of coordination across line ministries. And these coordination arrangements must also be manifested within the ministries of health. And so our work as WHO is to use these case studies to demonstrate how the normative guidance we've provided is manifested in different countries. And that's the central role that WHO provides because of our convening power. This meeting has given us some illustrative examples, and these examples will be published as case studies in times to come on the different governance models that countries are embarking upon.
As you heard from the WHO representative, Dr. Munene, he promised that he wants to have a major agenda at the World Health Assembly in Geneva next year, focusing on leadership and governance. So I think for me, it's exciting times ahead.